Hi, my name is Dr. Andrea Cheville. I'm an associate professor and research chair of physical medicine rehabilitation at the Mayo Clinic. Our group recently published a manuscript entitled The Appropriateness of the Treatment of Fatigue Patients with Stage 4 Cancer, and this was published in the Journal of Supportive Care in Cancer. We recruited a consecutive sample of 160 patients with stage 4 breast, prostate, lung, or colorectal cancer. Another enrollment requirement was that they have at least moderate to severe fatigue based on a 0 to 10 numerical rating scale, and the average fatigue score was 6.4. And we conducted the study to find out whether these patients are receiving guideline-appropriate care for their fatigue. We think this is an important question because fatigue is the most prevalent symptom experienced by cancer patients, and there is a fairly extensive evidence base indicating that certain groups of therapies are quite successful in managing fatigue, and there have been guidelines available now for roughly a decade. One, I think, of the most detailed and user-friendly is that promulgated by the National Comprehensive Cancer Network, and they break down fatigue interventions into 4 groups. General strategies, which includes things like pacing, energy conservation, activity enhancement, psychosocial interventions, which might be cognitive behavioral therapy for constructive coping, and the last is pharmaceutical interventions. And alarmingly, what we found was that roughly 10% of these moderate to severely fatigued patients had received concrete or prescriptive guidance in the most effective domains, which are activity enhancement and psychosocial interventions. Almost 40% had received a pharmaceutical prescription, usually soporific or sleep-enhancing drugs. Activity enhancement and psychosocial interventions are by far more supported, have a more robust evidence base in support of them than pharmaceutical interventions. But that's what patients are getting. So in conclusion, we found very low rates of guideline-congruent treatment reported by a mixed sample of late-stage cancer patients. And it was worrisome, particularly since the better validated treatments, such as activity enhancement and psychosocial interventions, were the least prescribed. I invite you to click on the link and read the study in full for more details.